And we're live. Look at that.
Yeah,
Hi, Tara.
Hi.
How are you today?
Oh, good.
Well, thank you so much for joining us today and helping us out with our South Valley Industrial Summit. So for everybody, as you join us, and we will set this up to record so that you can view it later. Tara is our food safety manager and senior technical manager for both Hydrite Chemical, or I apologize, I've got that backwards. So Joe, who is our senior technical manager, won't be able to join us today, unfortunately. But Cara is going to walk us through some of the Hydrite Chemical Company COVID-19 and perspective of assessing your facility for the new normal. Hopefully it's not necessarily going to be a permanent new normal, but that something where, as we as a food sanitation company have always worked on our sanitizing and good manufacturing practices, it really ties well to us. But there's a lot of industries out there that it doesn't tie to, that now have these responsibilities to meet those requirements. And so as part of that, Hydrite wants to help out in the community. And with that, I'm going to turn it over to Cara.
No worries. Great. Thank you so much. Yep. Let me share my screen here and hopefully we can see the slides here. Whoop, slideshow. Is that coming up as a slide presentation?
Yep, it's coming up, and then it's got no notes on the side, so I don't know if you
want okay, so I wonder if I can get it out of. Maybe that.
There you go.
There we go. All righty. Okay, now we're rocking. All right. Yep. As Lisa said, thank you very much for inviting me to speak here. I really appreciate it, and we'll hopefully walk you through the COVID and the new normal. The way that this presentation came about was we were actually partnered with the College of Sequoias back in September and gave a kind of two half-day presentation on COVID and the new normal, and kind of the walking you through some of the practices and procedures that you'll want to implement and just investigate in your food manufacturing facilities to meet the new normal. And like Lisa said, hopefully not a permanent new normal. Again, here's just a little bit of background about myself. Cara on the left there, been doing food safety for over 20 years. Unfortunately, my coworker, I call him Captain Chemistry. He is fabulous, but he is unable to join us today. And you can just see some of his background there. So I'm going to try and fill those big shoes, but it will be a fabulous presentation. So I always do this in all our COVID presentations and any presentation we give in general. Just want you to know where we're getting our references. So this presentation is based on the most current information that we have from these referenced sources and we enhance it with our own expertise. So if you're looking for any of this information, these are the references that we use, and it's up to date as far as November 2020. So just a little background, probably everybody has heard a lot about SARS-CoV-2, which is the virus. That's how you say the virus. It causes the disease COVID-19. So viruses are not living things. They need a host. So they need an animal, they need a human, they need a bacteria, depending on what type of virus it is. So SARS-CoV-2 is a human virus. It infects humans. It's novel. It's a novel virus. It's not previously been identified in humans. There is some transmission between animals and people. You'll see some of that information. We don't talk a lot about that in this presentation, but just to give you a little bit of background. And then it is spread, and I think you've probably seen this in a lot of information that's out there through the air. It's a respiratory virus that transmits between people through close personal contact. It's transmitted through air. It's transmitted by touching surfaces. Potentially, they don't think that is the primary way that it's transmitted, but it could potentially be transmitted that way, and it enters through your eyes, your nose, and your mouth. So it is a respiratory virus. So I always give this information, and because this is something that's somewhat new as far as data that's out there. So currently there there is no evidence that food or food containers or food packaging assist in the transmission of COVID-19. It's possible, but it's not really probable. It's spread through the close personal contact and respiratory droplets. And I did want to bring up this one reference here. It's called the International Commission on Microbiological Specifications in Food. I know, big, long, type of organizational name. So, but otherwise it's called ICMSF. And everybody always teases me because I talk in a lot of acronyms. So I always try and give you the acronym name so that you're not just thinking, oh my gosh, what acronym is that? So ICMSF is a collaboration of academia, government, and industry representatives that deal with providing scientific-based evidence to governments for guidance in these types of situations. So in these types of standards, or what to set standards and specific microbiological specifications for food. So they came out with an opinion piece in September, and this was kind of a big deal. And I know, like, nobody else but me thought it was probably a big deal, or people in the food world, though. This was a big deal because basically their piece was and I do have that referenced in this documentation, but this is a piece that says that that SARS-CoV-2 is a significant impact on human health. It absolutely is. But you can see in that second bullet point there, it should not be considered a food safety hazard. So as a food industry expert, we don't consider it a food safety hazard. Now, that being said, we're going to talk a lot about guidances and some tools that CDC, OSHA, and FDA have put out there so that you can keep your humans safe, right? So you keep your people safe. But there aren't any proven scientific cases or association between food consumption and COVID-19. So I want to make that very clear, in that this document is out there and it does have that information. There were some studies initially done, and I bring this up because it does play into what we're going to be talking about as far as controlling the surface contamination in your manufacturing facilities. So SARS-CoV-2, or the COVID-19 virus, how long can it be viable on surfaces? And so these are just some of the data that was gathered, and this was gathered back in March when this first came about, and there have been subsequent studies that have proven that these are about the right time ranges that these items, or this COVID-19, has been found on surfaces. Now, that being said, is it an infectious dose? Is it enough to make you sick? That's not what this study is saying. It's just saying how long it can survive on the surfaces. So you can kind of see there, what the time frame is for the survivability of the virus. But again, it doesn't say infectious dose and things like that you need to understand in order to what makes people come down with the virus. And I thought this was a pretty cool little tool. And again, I just like to give out tools and tips and tricks for people to understand what what's out there. What can I use to really understand this virus? Because this is a novel virus, so there's not a lot out there. There's a lot of studies going on, but there's not a lot out there as far as information, because studies take time. And so this is something that the Homeland Security Office, or the Department of Homeland Security Office for the United States, came out with. It's a pretty cool little tool. Basically what it is you put in a UV index, a temperature, and a relative humidity, and it gives you an estimated time that the virus will last in the air or will decay on surfaces. So kind of gives you a little bit of a time frame of what to expect as far as the survivability of the virus in air and the survivability on surfaces, given those parameters, if you know those parameters. Viruses are susceptible to UV. They are susceptible to temperature. They are susceptible to humidity. But for this novel virus, we're not exactly sure. We don't have an exact time, temperature, humidity, UV for every single situation. But this tool can give you somewhat of an idea of what might be in your when you're considering surface and air contamination. So next, for the next couple of slides, I'm going to give you just a toolkit that the CDC actually came out with. So a CDC preparedness toolkit for manufacturing facilities. And the reason that I like to introduce this to people, or that I give these slides in this presentation, and the reason that we gave it with the College of Sequoias, is because it's a really fabulous free toolkit that you can use. The reference was on the previous slide, but basically if you go to CDC website and look up manufacturing facility assessment toolkit, you'll find it. It's a super easy assessment checklist to be able to use to assess your facility for your preparedness for this virus. It was developed by the occupational safety and health professionals, and then state and local health. It was meant for state and local health department officials to be able to assess manufacturing facilities. It's not intended to assess regulatory compliance. It was a way that the local and state health officials were able to assess a facility to see if it would be safe for them to determine if they could enter into the facility in a safe manner, was the ultimate goal of the tool. But what we've been finding is that a lot of manufacturing facilities have found this really a useful toolkit in order to be able to prepare themselves for SARS-CoV-2. And so there are a few different elements of this toolkit. There's a facility assessment checklist, and then a facility assessment tool. And we'll kind of walk through what each of those might be and understand. But in general, most manufacturing facilities have started to, and hopefully should have some kind of COVID-19 control and assessment plan, should have some kind of COVID-19 preparedness team that meets to discuss the preparedness activities around controlling COVID-19 in your facility. And these are just some of the things that are items that are in the toolkit. And you're going to probably hear, I'm going to talk about a couple of different tools too that are available. Again, free tools. I like free. I think free is always good. People always appreciate it. But we're going to, until you'll hear some repetitiveness in these toolkits, but I think it's important because some were developed by OSHA, some were developed by FDA, some were developed by CDC, and they take a little bit of a different angle on each of these checklists. So the sections of the facility assessment tool kit for this CDC assessment they broke it out into 4 sections, and we'll just kind of briefly talk through each of those sections in the next few slides. So section 1 is facility and workforce characteristics. Number 2 is facility policies and procedures, and then guidelines and other resources, and then direct observation of the facility practices. And that's a really, if anybody has ever done good manufacturing practices, you're going to know that's going to be an important factor in understanding the overall compliance with your procedures once you have them in place. So the first section is facility and workforce characteristics. And this is, remember, SARS-CoV-2 is transmitted person to person, right? We're really concerned about that person to person. So what do you have to understand? You have to understand what that person to person contact looks like in your facility. So in your basic information for your procedure development, you're going to have to figure out, okay, how many shifts do I have? What's the start of the shift? What's the end of the shift? What do break times look like? We have to maintain social distancing, right? And so if everybody's going on break at once, your break room is going to be pretty full. So what does that look like? Transportation to and from. There's a lot, especially in the agricultural manufacturing or farming and things like that. There's a lot of carpooling that goes along, or busing. How do you maintain that social distancing? And you have to understand that overall in your understanding of, so that you can next, section 2, develop your policies and procedures. And so this is when you can start putting together those guidances, looking at those lists and putting together procedures. Okay, how am I going to handle breaks? How am I going to handle that lunchroom? Are we going to put up plexiglass to partition people? What does that look like? And we will go through this in a little more detail in another checklist that we have. Guidelines and other resources. So what I want to make sure that you do, and you're going to hear me say this over and over and over and over and over again, is I want you to make sure that your guidances and other resources are dependable, they're reliable, they're science-based. These are some of the opportunities or some of the guidances that you can use. I'm sure there are others out there. Europe has some excellent guidances on the control of COVID-19 in manufacturing facilities. Remember, they kind of hit it first. They, so they were kind of one step ahead of us on this. Not unfortunately, right? But they do have some really excellent guidances too. But make sure that you're using reputable resources that are science-based. Section 4, direct observation of your facility. This is the best thing, and I always say this, so I do a lot of GMP training and do a lot of other food safety training. You can't sit at your desk and try to visualize what's going on out in the plant. You need to go out and just take a look. When employees are entering into the facility, when they're exiting the facility, what does that look like? What do breaks look like? What does lunch look like? Evaluate items like they're saying here, are people using the appropriate PPE? Are people social distancing? And then you modify, right? You modify based on those observations, based on the local guidances. Your local health department is going to be an excellent resource for you, and we'll talk through that in one of the next sections too. All right, so we kind of gave you, that was just like a little tiny taste of what we're going to get into in these guidances and things like that. But what I wanted to go through now is with the next guidance document and the next checklist that I'm going to talk about and the resources I'm going to talk about, we talk a lot about sanitizers and disinfectants. And what we were finding is we jump into this information and people are like, what's a sanitizer? And we want to make sure that we kind of just cover the bases here from the get-go here. So got a little bit of animation going on here. So why do we sanitize in our food manufacturing facilities? We're doing it so that we make safe product. We're making sure that our product, our environment is clean so that we can make clean product. Same thing goes with COVID-19. We need to make sure that our environment is clean so that our employees are safe, that they are safe in the environment. And so why do we have to sanitize these buggers here? Bacteria, mold, yeast, viruses, protozoa, all those guys. We want to get those out of our facility if at all possible. And so in food manufacturing, we worry about it, especially with some of our equipment and things, because we can get those cracks and crevices, right? Those where we can get some of those bacteria building up in there. So that's why we can clean, but then we need to make sure that we sanitize too. And we always need to clean before we sanitize or disinfect, because it's not going to be effective if you haven't performed your cleaning activity prior to either sanitizing and disinfecting. And so I'm going to go through the difference between a sanitizer, a disinfectant, and a sterilant. And so this is where people were getting confused, especially at the beginning of COVID-19, about what's the difference and what's the activity. So sanitizers reduce the level of bacterial contamination. So we clean and then we sanitize. And this is regulated by the Environmental Protection Agency, or EPA, another acronym. Try and give you the whole word there. But they are proven out through a sanitizer efficacy test. So a food contact sanitizer must kill 5 logs of certain organisms. So these certain organisms, you have to reduce it by that much. So what does that mean? Basically, that's like pasteurization. So we're trying to pasteurize our manufacturing equipment. And so that's what sanitation does or sanitizers do for you. Now, disinfectants, which is what we hear a lot, because sanitizing is not going to get rid of viruses. We're going to get rid of bacteria, but disinfecting actually is more stringent. So a more stringent kill of these microorganisms. So disinfecting kills more spores, viruses, and bacteria than sanitizer. So your sanitizer is going to get rid of that bacteria, but it's not going to get rid of those viruses, which is what our COVID-19 is. And generally, a lot of times your sanitizer can be used as a disinfectant. It's just used at a higher concentration and, generally speaking, a longer time. Now we'll talk about where you can find those disinfectants that are available for SARS-CoV-2 through the EPA List N. And I have that just slightly after this particular area of understanding or area of the curriculum. So then we have sterilants. Most of you, if you're in food manufacturing, are not going to use a sterilant. It's generally, again, could be potentially the same chemistry that you're using at a higher concentration. But this is when we're talking about like autoclaving. If any of you are familiar with autoclaving, you're getting rid of spores, you're getting rid of everything. Most of the time in food manufacturing, we don't worry about sterilizing things. A lot of times that's more in like the pharma type of industries. So can you clean and sanitize in one step? And so we always just say that because we get this question all the time. Yes and no. So you might hear about some claims that of items or chemistries that you can do that, but in the United States, you need to have a clean and then a sanitize. So it's 2 different steps. And if you read the label, and this is going to be something that I'm going to repeat like 500,000 times for you, read the label. You're going to get tired of me saying that, but read the label. You need to make sure that you clean and then sanitize. And the purpose of cleaning is to get rid of that soil. So it's the same thing if you disinfect. You want to make sure that you're doing that cleaning and then you're disinfecting the area. So here's just, we always say, like, why do you want to clean or why do you want to sanitize, and making sure that you understand, the ins and outs of sanitation in your food manufacturing facility. So basic chemical sanitizers, the EPA administers the registration of the sanitizers, and then the FDA sanctions several chemicals for use as no rinse food contact sanitizers. With disinfection, if you use a disinfectant on a food contact surface, you need to clean that food contact or rinse that disinfectant off and then re-sanitize, because you cannot use a disinfectant on a food contact surface and then put food directly on it. That is not acceptable per EPA registration of disinfectants. So you need to make sure you're reading the label again, but if it's a food contact surface and you disinfect it, then you need to do that rinse and re-sanitize. So basic chemical sanitizers, a lot of them have a broad range of activity. Same thing with disinfectants, broad range of activity. Could possibly, and here's the evolution of sanitizers. We just always like to kind of give you and I'm going to walk through each one of these just a little bit in detail, because a lot of these have disinfectant properties too. And again, what you need to do is look at the label and make sure that you're at the proper concentration and time for that disinfectant activity. So alcohols have been around forever. We always say that, probably since we've walked the earth, we've tried to figure out how to produce alcohol, right? And it's a really great disinfectant and really great sanitizer, but there are other options you can see there. So bleach is another one, often considered the reference sanitizer. So that's usually the one that when they're doing studies, they reference the bleach or the hypochlorites. Quaternary ammonias, which is quat. A lot of you probably have heard that. Peracetic acid, chlorine dioxide per quat, and then the silver dihydrogen citrate protein. So here, just walking through, just so you have a somewhat of an idea of what each of these are effective against. So hypochlorites, again, I said that this is bleach. This has a broad spectrum of kill, oftentimes considered the reference sanitizer. Thing is, it can be very corrosive for equipment. You need to understand what you need to use it for, and then on what you're using it on. And the same thing goes for disinfectant properties with that too. You need to understand where you fall with that, and certainly ask questions of your chemical representative, because they'll be able to guide you if that's the appropriate disinfectant or sanitizer for you. Quats or quaternary ammonias, again, these are great. Again, they do have some that can be used at disinfectant levels or sanitation levels. You need to understand what the purpose of it is, and then again, where you're going to be using it. Some applications of quaternary ammonias are not going to be as effective as other chemistries, so you need to understand what those types of applications that you are going to use. Peracetic acid, or PAA, is another one. This one too, it has a broad range of efficacy for the overall scope of disinfection and sanitation purposes. But again, you do have to make sure that you know what you're putting it on. It can corrode aluminum. You can only handle it with plastics. Some metals can cause a reaction. So if you're going to use like a dip tube or things like that in your tote, make sure that you contact your chemical representative, because that is a problem. So you just need to make sure what you need to, what you're going to use it for, so that you don't end up harming your equipment, pieces of equipment, unintentionally. Chlorine dioxide, again, this is another really great sanitizer, disinfectant at different disinfectant levels too. Economically sound, it's rapid and broad kill. One thing that I always just kind of not warn people about, but some sanitizers have better efficacy against some microorganisms versus other microorganisms. So chlorine dioxide is one that I've actually had a lot of experience with, in the fact that it's not as effective against yeast. So I had a customer, a client back a few years ago that was using this to fog their manufacturing facility. And it's great. It's an awesome broad spectrum kill for gram-positive and gram-negative bacteria, but it's not as effective against yeast. And they were manufacturing beef jerky. And what was happening was it was getting contaminated with yeast, and it would end up on the shelves of the grocery store and start exploding because the yeast started growing in it. So make sure that you know what you need, how you want to handle that, and make sure that you understand the efficacy of those types of sanitizers and disinfectants. Per-quat technology, this is a great technology if you have biofilms. It's extremely effective against both gram-positive and gram-negative bacteria. This has been a pretty common technology, a common chemistry that has been used in a lot of manufacturing facilities for the fight against COVID-19 too. It's been a really effective disinfectant. The one thing about this one is it can be a bit more expensive, but it is extremely effective. And also you need to be aware of your wastewater treatment. Just it may affect your wastewater. So you just have to be careful about understanding that, and work again with your chemical representative on that one. Silver dihydrogen citrate, this is another great use. It has a broad spectrum of kill. It's been very effective and it's been very widely used now in this day and age. But what you just need to understand again is, you need to understand the concentration and the chemistry behind it, and understand the application, because if you don't apply it appropriately, it's not going to be effective. So again, All of these sanitizers and disinfectants are very effective against a broad spectrum of bacteria and viruses and yeasts and molds, but some have more efficacy than others. And you do need to understand where that is in the overall effectiveness of sanitizing and disinfecting your facility. Effectiveness factors, this is another one that we've run into a lot. Understand and read the label, understand the concentration of the disinfectant level that you need, the time, the temperature, the time of exposure is really important. It is on the label. Once again, I'm going to tell you, it's on the label. And then the cleanliness of the area, making sure you understand that. Water hardness is something that people often overlook, making sure that you understand your water, incompatible agents, again, making sure that you're not mixing acid and base so that you don't gas out your entire facility. Read the label, work with your chemical supplier because they will help you so that you have an appropriate type of usage for that. Water temperature can sometimes affect it too. Making sure, and I don't want to get into super duper details here, but making sure that you understand what that looks like for your chemistry that once you choose that chemistry. Effectiveness factors, and again, a lot of what I have seen with the especially with COVID-19 is a lot of people are using fogging, which is fabulous. Make sure you read the label that your disinfectant is approved for that action and that action is appropriate for that chemistry, because you want to make sure that you're getting the best bang for your buck, right? And that you are using the chemistry in the appropriate manner so that you are controlling that. So that's my advice about that. Preferred application, again, if we're talking about, and we're going to talk about surface cleaning and how you can get have the surface cleaning of your particular facility. Preferred application of disinfectants and sanitizers is going to be soaking or spraying. Circulating is more with sanitation and CIP, and then foaming and then fogging finally is the most. So if you're going to do those types of activities, fogging is generally the least effective, but not saying that it's ineffective. Make sure you're doing it at the proper concentration and rate. And again, here's just some no rinse concentrations for sanitizers. But like I said, with disinfectants, if you do a disinfectant level chemistry on food contact surfaces, you need to rinse and then resanitize at this level. And that's why I stuck that little slide in there. All right, so you're like, oh my gosh, that was a lot of information about sanitizers and disinfectants. Trust me, I know. But in the United States, and this is what I want to make sure that everybody understands, in the United States, when the pandemic started to occur, the EPA put together a list of chemistries that are available that are considered effective against this novel coronavirus. So when we talk about the novel coronavirus, that's SARS-CoV-2. So this is a new virus for everybody. This is novel. And so they put this list N together, and all you have to do, I have the little link down there, but all you really have to do is type in EPA list N in your Google, and this will come up. And they've made it really super easy to use, super searchable, and I have some examples coming up here too. But what I want you to understand is that the chemistries that are on that list meet the criteria for the kill for this virus. So this virus that causes COVID-19. And this list was developed because these sanitizers are effective against a virus that's at least as the disinfectant can kill that virus, that at least a virus that's harder to kill than SARS-CoV-2. So when they first started putting this list together, we didn't have any sanitizers that had been tested against this SARS-CoV-2 because we didn't have the virus, right? We didn't have access to the virus. Now there are some on the list that have been tested through the EPA protocol against SARS-CoV-2. But otherwise, what you're going to see is you're going to see other viruses listed on there, and that's okay. But you have to follow the time and the concentration that's on the list or that's on your label for disinfectant purposes in order for it to be effective against SARS-CoV-2. So some of those viruses that you're going to see are going to be like norovirus. So if anybody knows norovirus, hopefully you've never experienced it, but you probably have. It's one of the most common viruses around there. It's the gastrointestinal virus. It's really miserable if you ever get it, but it's a hard to kill virus. And so these sanitizers or disinfectants have been tested against that virus, and they were effective as long as you have it wet and as long as you have it at the right concentration for the time that it says on the label. So that's what I want you to understand. We have gotten some disinfectants that have been tested against the actual virus, but if you see, you're like, well, it doesn't say that it's SARS-CoV-2. That's okay. If it's on list N, it has the applicable efficacy against a different virus that's harder to kill. All right, so that was a lot of talking about what list N. Let's get down to the nitty gritty here, right? So how do I figure out if my sanitizer or disinfectant is on list N? All right, go to your EPA registration number. You might not be able to find it by the manufacturer name, because a lot of manufacturers will sub-register their chemistry. And so you find the EPA registration number and you plug that into list N search feature. And this is what's going to come up. And that's what I just showed you on here. So we have a label on the left-hand side there. I found the EPA registration number. I stuck that number in. So you'll see it's the first 5, 6, 7, 8 numbers there. You stick it in list N, and then that's what comes up. So for this one, it says contact time is 10 minutes. But again, read the label. Make sure that you have the appropriate concentration and contact time for the label. So, and what I want you, so this is the nifty list N tool that they have. It's really easy. You can actually browse by, if you're looking for something for a soft surface, and we'll talk about soft surfaces in a couple more slides here. But if you're looking for something like that, you can actually browse through this looking for disinfectants that are effective on soft surfaces. What I want you to understand too about EPA, so US EPA, what does that tell you? US, United States, EPA, list N. And so that's based on the United States regulation. Other countries may have different expectations and different regulations. So make sure that you understand. Also, states may have different regulations. New York State has different expectations slightly than list N. Make sure that you're understanding what those local regulatory requirements are. So especially if you're international. All right, I'm going to do a short stint on hand washing because this is so important. And I just want everybody to understand the efficacy, because if we just washed our hands, we could prevent a lot of transmission of not only COVID-19, but many other communicable diseases and things like that. And I know I was into hand washing before it was cool. So I'm always a pretty big advocate of everybody washing their hands. So training is super important. And we have these slides that we put together for the benefits of hand washing, and we've handed these out 1,000 times, especially now. So we're going to talk a little bit about what's the right procedure for hand washing? Why do we wash our hands? When do we wash our hands? So the benefits of hand washing, it's great, but do a risk assessment of your facility and making sure your operation, do you have enough hand wash sinks available? What does your hand wash sinks look like? What are the do you have towels? Do you have blow dryers? Those types of things. So do that risk assessment, and then establish employee hand washing practices. And we'll talk through a little bit about this too. But you should have a specific hand washing procedure. The most important thing about hand washing is that length of time. Standard is at least 20 seconds. That's where you're going to get your most bang for your buck. And that's really what is important, just that length of time. So what types of hand washing sinks or what types of hand washing compounds are needed? And I'm going to talk through a little bit about that and just that type of understanding. Where do you have to have hand washing sinks? Where should you use gloves? Where should you not? Length of time to hand wash, and then proper or use of paper towels or touchless blow dryers, and then frequency of hand washing. So what are the cleaners and the hand sanitizers and hand cleaner ratings? So this is just a breakout. This is the National Sanitation Foundation, or NSF. Probably a lot of people have heard that terminology before. This is what is designated. So you're going to see this rating on a lot of hand washing cleaners and sanitizing products. And so understand wherever you're going to put that in your plant, make sure that the appropriate rating is at the appropriate location in your facility. And that's what I want you to understand. That's why you do your risk assessment, right? And you make sure that these ratings are appropriate for the locations of your facility. So the benefits of hand washing, here's a study that was done that says it can reduce at least a log up to 2, almost 3 logs of bacteria in your hands. Remember when we were talking about sanitizers? Sanitizers do 5 logs, but hand washing can do 3 logs. That's a lot. That's a lot of bacteria that you're getting rid of just in a short amount of time. And this is an oldie but goodie. Where is hand washing areas or areas of your hands most of the time missed? Your thumbs. People always miss your thumbs. So don't forget your thumbs. But this is just, again, this study has been mentioned time and time again. So protocol, use warm water if possible. It doesn't really matter water temperature. Here's the thing, you want to make sure that people are able to hold their hands under that water for that 20-second time, right? So if your water is super ice cold, I mean, I'm from Wisconsin, I can deal with cold water, but 20 seconds in ice cold water is kind of tough. 20 seconds in boiling hot water is really tough. And so you want to make sure that it's comfortable, that people can get that action in the 20-second time. And you want to make sure that you're rubbing together vigorously. Remember, getting that bacteria off your hands. Mechanical action will super help you out with that. And then you want to rinse with clean water. And again, make sure you pay attention to those areas that are potential hard to get, and then dry thoroughly. When should you wash your hands? All of these things, wash your hands. I think everybody's washing their hands frequently right now, of course. I hope everybody keeps that up, quite honestly, but at least after you go to the bathroom, or if you pick something off the floor, if you touch your face, or if you cough into your hands, make sure that you're washing your hands after you do any of those types of activities. Now, gloves is always a controversial one. What I want you to understand is that you have to do your risk assessment. You have to understand where gloves should be used in your facility. But if they are used in your facility, make sure that they are properly cared for and changed frequently. And this goes in your daily life. I see people at the grocery store wearing gloves, but then I see them touch their face and they rub their eyes, and I'm like, oh my goodness, that's not good. So gloves are, we're not, it's not going to be the replacement for proper hand washing and proper hand sanitation. Again, these are just some recommendations. These just come out of my experience. Touchless is awesome. If you can do touchless sinks, touchless soap controls, that's the best way to do it. Paper towels are really nice because sometimes blow dryers can be a source of contamination rather than, just drying your hands. Paper towels are awesome. I get it, but you need to also have, the appropriate amount of paper towels and a way to throw them out in the best manner possible. All right, and I did want to bring this up. So we talked about hand washing. Ideally, what you want to do is you want to use hand washing and then hand sanitizer, right? So there's lots of options out there for hand sanitizer for you, but there has been a hand sanitizer recall. And the reason that I put this in here is on Tuesday, November 10th, FDA actually put out a podcast that's about 11 minutes long. It's a fabulous little podcast if you're in your car driving somewhere, to be able to just listen about this hand sanitizer recall. So there have been some recalls. There were some products that were not made with the appropriate type. You can see here the appropriate type of alcohol in them, and they were getting people sick. So make sure that you know that you look at this list, look at your hand sanitizer, and make sure that you understand if your hand sanitizer falls into this on this list. Don't use it if it does. So make sure that you are using the appropriate hand sanitizer. Now, another thing that's happening in the world of hand sanitizer too is that there is a temporary policy about people being able to make hand sanitizer, kind of beyond what the EPA and FDA have done in the past. And so a lot of, like, I think you saw, like, a lot of distilleries and things like that started making hand sanitizer, which is awesome, because then we had it. We were able to have it so that we can fight this virus, right? The problem is sometimes they were packaged in containers that looked like food, and people were getting sick because they were drinking the hand sanitizer. So don't drink your hand sanitizer, but make sure that you understand there are, the FDA did issue this warning on this. And again, that FDA podcast had a little bit about that. All right, so we're going to walk through. We have a couple of different kind of cheat sheets, I guess, for you here, or checklists that came out and this one came from OSHA and the FDA. They combined together to put together this checklist. I love this checklist, because when I went through this checklist, I was like, oh my gosh, I did not think about a lot of these things. And this, what they did, again, they put this together just to give everybody, again, it's not used for regulatory assessment. It's used so that you can assess your facility, so to make sure that your food safety and your employee health for human and animal operations during the COVID pandemic are up to par, right? So that you are controlling, that you're thinking about everything in your manufacturing facility. So again, here's some of the elements of these checklists. And so this might look pretty similar, again, to that CDC checklist, but this one kind of touches a little more and is a little bit more robust on the food safety side and the food, the food manufacturing side. And again, I really like this checklist because it made me think. It made me take a step back and talk to some of my friends in industry and be like, I didn't think about this before this checklist. So again, like, for instance, here's some of the elements with the work configuration. I know a lot of you have been in the manufacturing facilities, and you know how tight it can be. How do we prevent that? How do we minimize that? How do we help our employees to get the 6 feet apart? What does that look like? Does that look like plastic shields in between? And then you put those plastic shields in between. Are you sanitizing them? Are you cleaning them? Making sure that that's all thought about. Ventilation. You're going to hear a lot about ventilation, and especially now that we're moving into the winter months. I know you guys out in California probably don't have the same problems that we have in Wisconsin, where we just board up and then we just stay at home and we don't go outside because it's -20. But ventilation is going to be a super important aspect of this, and just understanding, and then educating employees. There's a lot of really nice, again, free literature out there and signage out there about minimizing, getting that employees to understand that social distancing and understanding how to maintain that social distancing. But this is where I found this checklist really kind of helpful for me. This started making me think, okay, food safety planner, HACCP plan, and personnel and supplier. There's been a lot of supply chain disruption. How does that change my food safety plan? If my ingredients change, does that change my food safety plan? It might. We might have to change our food safety plan to update those changes in ingredients, changes to operations. Now that we're having a few more personnel that are sick, potentially out, reduced personnel. How does that look? What does that change in our procedures? New suppliers. And I've talked to several people across industry, and we thought we we had the new supplier thing buttoned up. We thought we were awesome in that realm, and it turns out we weren't. You know, this is going to change the way that we approve new suppliers probably forever, because of supply chain disruption and things like that. So what are your supplier verification activities? Some ingredients that you receive in, you might have said, you know what, we're going to do an on-site audit, and your new supplier is going to be like, you're not coming in here, not now. We're not allowing anybody in. How do you change that verification activity? So I thought this checklist was great in that it really just helped me to understand, to think about, okay, what do I need to change in my food safety programs that are probably really well established, but that maybe, are going to affect my food safety plan because of the pandemic. And I think some of these, this is just some of the kind of highlights of that checklist. And so procedures modifying your hand washing. I know a lot of manufacturing facilities had to put in more sinks, more hand sanitizer stations. Some manufacturing facilities had to go down for a couple weeks or possibly a week. Your pest control becomes very important at that point. Tools and utensils not shared. We start to think twice now if we're going to share a calculator, if we're going to share a pen, if we're going to share a computer screen or a computer keyboard. What does that type of information look like, or what does that type of procedure look like? So again, that's, all things that this checklist just allowed me to think about. All right, now we're going to just take a moment and talk about sanitation considerations during the pandemic. And so what if you have an employee test positive for the virus? And in all the guidance documents, one of the first things that they say is just contact your local health authorities. It's highly encouraged. It's not mandated, it's highly encouraged. And there is a link there to local health authorities. You can work with them and they can help you in addressing these situations. I know I've had a few friends in the industry that have had some of these issues, and they've worked with their local health authorities, and it's worked out fabulous for them. It's really helped them to be timely and accurate in information, and just really get them up and running once again. So prior to development of your sanitation planning, you want to do a risk assessment. So what does that look like? That's, again, we already talked a little bit about a risk assessment with our people. For sanitation, we're going to do a risk assessment. Just think about our current sanitation, our current GMPs, and then we have to understand our local dynamics with the virus. Think about the supply chain. There have been some supply chain disruptions with some chemistries and some supplies like PPE and things like that, or personal protective equipment. Making sure you understand what that availability is, making sure you understand what those items are. And again, this is just my little list here that I pulled out of the CDC guidance. But you could add several different things with your pandemic preparedness kit. So again, then you're gonna do this risk assessment, and you're going to have to figure out, okay, based on this outcome, what additional sanitation procedures might I need? What sanitation products might we have to consider? Maybe we identified that one product that we normally always had and always used is no longer available. What's our substitution? How can we get, how do we get around that, or how do we manage that? Again, resource availability to taken into consideration for development and implementation of these procedures. And then GMPs, don't forget the basics, right? I think a lot of people, you get very concerned about COVID-19, and you absolutely should, but don't forget your basics. There's still recalls going on. There's still regulations and things like that, or regulatory action going on with recalls. So don't forget your basics. I did put a little tiny bit in here about contact tracing. What I would say with that is, if you are thinking about developing something with that in your pandemic preparedness kit, make sure that you're working with local health department and understanding what they're going to do and what their recommended procedures. Most local health departments have really awesome procedures in place or available for your use. So again, collaborate with that health department if possible, or if you feel that it's necessary. Again, they do have a lot of information that is useful and, again, free. So sanitation is the portion of your preparedness package, though. So it's just one little portion. I think you've seen that there's like a lot to this, but I want to go into a little bit more detail about this. This is, just kind of the basic steps for cleaning and disinfecting of your manufacturing facility. Plan, implement, maintain, and revise. And so this is the guidance, the CDC guidance that's out there for our public workspaces, businesses, schools, and homes. We'll talk a little bit about your manufacturing facility too, but we're going to plan, we're going to implement, and then we're going to maintain, and we're going to revise. And we're going to talk through each of these in a little bit more detail. So I don't want to jump ahead of myself and talk about it twice, because that's no fun. All right, so planning. What do you need to do? Well, you need to determine what needs to be cleaned and sanitized and or disinfected. So you take again a little risk assessment here. You determine what needs to be cleaned. So again, you're going to prioritize. Remember, some of these products may not be readily available. So what does that look like? So if there's a surface that isn't touched but once a day, do you need to clean that and disinfect that every 15 minutes? Probably not. You're going to prioritize with that. Has the area been unoccupied for 7 days? What does that look like? And then again, consult the products on list N. So make sure that your product line is appropriate. And then common areas or frequently touched areas may need that additional cleaning, sanitizing, and or disinfection. And you got to do that risk assessment to understand that. Now, this comes out of Cornell University. Cornell has a fabulous website for COVID preparedness, for COVID-19 preparedness. And these are just some surfaces that they had identified as common areas and then high touch surfaces. So these might be the areas that you're going to concentrate a little bit more on for disinfection. So in your processing area, thinking about your processing area, what are the areas, what are those frequently touched surfaces that you're going to be concentrating on for your disinfection? Now, remember, if you disinfect a food contact surface, you're going to have to rinse it and re-sanitize it. Do we really need to disinfect food contact surfaces? Probably not. Probably not. It's not going to be an effective use of your resources for that, but it depends. And again, you need to do your risk assessment and understand that. But increased sanitation efforts may be necessary for those frequently touched surfaces in those common areas. So these are just, again, some of the common areas, and then the frequently touched surfaces. And again, these are most of the time non-contact food or non-food contact surfaces. And what's our goal? Our goal is to prevent the spread. And so we want to clean and disinfect those surfaces that are frequently touched, because that's going to increase our efficacy in preventing that spread. So how will the surfaces be cleaned and sanitized and disinfected? Again, the type of surface and how frequently it is touched. You want to prioritize those highly touched surfaces. So, handrails, bathroom doors are more frequently touched. And again, hard non-porous surfaces frequently touched may need routine disinfection. And again, you need to understand though with your risk assessment. Now, soft or porous materials, so like carpets and like chairs that have padding on them, it's harder to disinfect those surfaces, and it's harder to, and they do have products on list N, but it's just harder to have those surfaces disinfected. So you just want to make sure that you're doing the appropriate disinfection for the surface. So here are just some items. And again, this is just a common area for routine sanitation, standard sanitation operating procedure. And again, this is a guidance. There's a lot of information out there. So yours may not follow exactly this, but this is just kind of a guidance. What they're saying is that, if the area has been closed off, ideally it would be if a person has tested positive in that area. Ideally, you'd like to close it off for 24 hours before beginning disinfection. Most of the time that is not possible. So do your due diligence and understand what you need to do to keep, not only to get that area cleaned and disinfected, but keep your employees safe. So then you remove the debris, wash. Again, remember, you got to wash before you disinfect, rinse, and then you do the disinfecting according to the label, and document everything that you do. So, and again, this is just, again, kind of more outlining what some steps are for what might look like for additional sanitation and disinfection of that common area. And again, vacuum the space if needed, but vacuum should be equipped with a HEPA filter. Don't vacuum with people in the room. And again, use that list N chemistry for your disinfection. Temporarily turn off in-room window mount or on-wall recirculation, but do not deactivate your central HVAC systems. Consider temporarily turning off room fans. And again, you're going to have to do this risk assessment. You're going to have to understand your area. And then once the area has been appropriately disinfected, you can open it up. And so that is important. And then again, if it's been more than 7 days, additional cleaning and disinfection may not be necessary, but you need to do that risk assessment. You need to understand that for your facility and again, this is a guidance out of the CDC. So you need to identify those appropriate procedures for you. Verification, there are a lot of tests out there that you can use to test surfaces for SARS-CoV-2. I think it's up to you. You need to understand, what I want you to understand with testing for SARS-CoV-2 is, does it detect infectious virus, or is it virus that's inactivated already? So, and then what happens? How much is there? And then what happens when you get a positive? So what are you going to do with that result? Make sure you have your corrective actions identified if you're going to do any type of surface testing of the area. All right, so plan. So we went through plan and making sure that you're keeping all of these things in mind. That second one there, keep in mind the availability of PPE. What I always like to remind people is that cloth masks, we're all wearing them, and that's fantastic, but they're not going to be a substitute for appropriate PPE for chemistry, applying chemistry. Making sure that you have the appropriate PPE for applying that disinfectant is important. So then you're going to implement. So what is implementation? Cleaning the visibly dirty surfaces and then disinfecting, using the appropriate product, and then following the label and writing everything down. So if it's not documented, it's not done, right? We all know that. Hopefully we all know that. If you don't know that, now you know that. So pre-clean, then you're going to disinfect, read the label. That's my, I think everybody's going to walk away going, well, I think we have to read the label. Yes, read the label, and then allow the surface to dry, air dry, wipe dry, but make sure that you have the appropriate level on there. So there's your label. Read the label. Yes, exactly. Too funny. Oh, I can't hear you. Too funny. So, and then the proper PPE. So again, read the label, proper PPE. All right, and then procedure for additional cleaning activities. Make sure you document it. If it's not documented, it's not done. Have all of these items on there. So the contact time that's on the label, the concentration, the location, and I have a little form mocked up here. So again, you're going to get that contact time off the label. You're going to get the concentration off the label. Location is really important, right? Because we need to know where we did it, and then what time, and then who did it. So we want to make sure that we're understanding. And again, here's a nice little checklist for you here. The 6 safe and effective disinfectant use. Just a little, kind of visual for you there if you want to look at it. And then maintain and revise. So continue that routine cleaning and disinfection, maintain those safe practices, and continue practicing those potential items that will, we want to make sure that we're making sure that we're doing this routinely. But just because we implement something doesn't mean that we're going to continue to be able to just do the same thing over and over and over again. We got to revise. We got to, maybe there's a surface that we've identified in the past is not a high touch. All of a sudden it's a super high touch surface. Make sure that you're identifying that and looking at that and revisiting that and revising your plans. All of a sudden your PPE availability or a disinfectant availability, reduces. How do you plan for that? What do you do for that? So making sure that you're identifying those activities and then updating your procedures and practices to meet those activities. And then, so what, I get asked this question all the time. What's frequency? What's the, how frequently should I touch, or how frequently should I disinfect frequently touched surfaces? So the guidance documents say at a minimum daily, but more frequently may be necessary. Some guidance documents will say, we'll recommend every 2 hours. What you need to do is take a look. How frequently is that surface touched, and then you have to decide. I've seen some facilities where they wipe things down, or they disinfect things on a every 15 minutes, every half an hour. And again, make sure that you're doing that based on your availability of people, the chemistry, and then the PPE. So just making sure that you're understanding all of those activities and revising it. And again, I jumped ahead again, of course, and I just say that cloth face coverings are not an appropriate substitute. For PPE, where respirators or face masks are recommended or required. If you're sick, stay home. That should be in your procedures. And again, so these are some of the items that you can include in your procedures. So again, these are just some overview of maintain, revise, continue to practice so that you reduce that potential, continue that social distancing. Remember, that's one of the best ways that we can prevent and mitigate the activity, the spreading activity, and then again, maintaining those engineering controls, reduce sharing of common places or frequency touched items. And I thought this was a great recommendation here. Remove some of those frequently touched and objects in common areas, such as coffee creamers. You have that pot or that coffee pot sitting there, and people touch that. And that needs to be, something that either then you're maintaining, or that you need to maybe just get rid of, and maybe you go to single use type of items. Just kind of depends on the outcome of your risk assessment. And then again, review your sanitation procedures as necessary, and always feel free to consult experts and your chemistry supplier or something along those lines, or other experts. There's tons of experts out there. A lot of universities have excellent expertise in this and are willing to help you with understanding all of those activities. So make sure that you're revising. And then I didn't put a slide in, but this is my last slide, but my takeaway too is don't forget the basics. People get very distracted by COVID-19, which is fantastic, but don't forget your GMPs, your good manufacturing practices, because we still have to follow those. That is still the law. You need to still comply with those. So make sure that you're still maintaining those activities. So, and with that was the last slide. So I don't know if there's any questions or comments. And like I said, my buddy Joel is out of commission today, so but feel free to email me. There's our nice little food safety at hydrite.com. It makes it easier, then you don't have to spell Baldus right. So I don't know if there's any questions or.
Well, I cannot thank you enough for being here today and helping the South Valley Industrial Collaborative share knowledge with our community. I did go ahead and put some links over in the chat. We will we'll also post a recording of this today. So I apologize, I'm gonna lose my voice for a moment.
No worries.
Always great while you're trying to record, right? So,
yeah.
You mentioned the importance of reading the labels. So the great thing was we had a customer make the formula, send it to another customer, we didn't have them make it, but they were making the formula, sent it to another customer, and you get this fancy little bottle, and I'm trying to make it show up in here.
Oh yeah.
But that it comes in and it looks like a liquor bottle. Well, I really can't get this to work, can I? But it says not for consumption. You really need to pay attention.
Yep. And they've actually had some instances, unfortunately, with children, because they'll be scented with like berry or chocolate, and they've had children ingest them because it smells good, you know.
Yeah.
Who wouldn't wanna? So but yeah, it has to, you gotta be really careful. So
But along with that too, you know, don't let all of this overwhelm you. You and I, this is our daily life. This is part of what we do and what our employees do. But there's so many other industries that are out there that are going through this, that it's hard for them. But
yeah.
they, you know, hopefully this helps them to know that there's a lot of great resources out there. You know, we've got I've posted some of the info for Tulare and for Kings County Health and Human Services agencies. You can use those links to find local testing facilities. Cara and Joel are doing a few sessions with our College of the Sequoias. So there's a link there that you could look at that. We also have our Hydrite basic COVID information. So that link is there. You can just go to hydrite.com. CMTA is the California Manufacturing Group. They're helping a lot of individuals with how to get the right PPE. And along with that, the really important thing, I think the takeaway needs to be, is we struggled at the very beginning. We're food sanitation. There's certain products that are part of your master cleaning schedules. It's part of your process and your GMP, that those are utilized in your true manufacturing food contact surface areas. And then when you start to use them in other areas, it takes away from the availability of that product for what you need it for. So reach out to your sanitizing company, reach out to Hydrite. There are other materials that you can use within your workspaces and your shared locker rooms, that kind of stuff, for when the employees are not entering the production and working in the production area.
Yeah, so, absolutely. And I'm all about free resources. I mean, I think everybody likes free. That's why I you know, you try and use those, and they're fabulous. They're fabulous resources. So, and you know, that's always, and always feel free, you know, again, the food safety at hydrite.com, we're always available to be able to answer questions, or, you know, if you have questions. So.
And Cara was just, you were brought into our new marketed RITE team, RITE,
yeah.
And that real time, how you share
innovative, real time innovative technical experts. Yeah. So yeah. We're really excited.
Yes, because we, you know, there's 1,000 of us as Hydrite employees at this time, along with all of our customers, and it's really going to give us a great opportunity to assist our customers and our communities a lot better, to be able to have a group that, you know, our team can go, let me ask the right person, the technical experts, and be able to get you the right information as well. Beyond that, did anybody else, Sammy or Tara, I see you are still out there. Do either of you have any questions?
You can always email. I know sometimes it's hard to ask, or you think about it tonight and you're like, oh, that's right.
Yep, so I think they posted. But what I do want to say though is, you know, obviously very thankful. For me, I attended a economic seminar earlier this week. A lot of people are very nervous. One of the comments was that we're living in an age of miserableism. And I think a lot of it is the fact that we're getting too much information and not the information we truly need. And so we need to kind of focus on the positive, focus on the fact that there are opportunities to not only help, but receive help out in your communities. So never hesitate to, you know, to look and to reach out to the people that participated today. Especially a huge thank you to Saputo, one of our primary sponsors, as well as Electric Motor Shop, California Dairies, forgive me, BMI, Mechanical. So all great organizations that are here that are part of the South Valley Industrial Collaborative. And we're really here to help businesses to maintain the business they have and continue to grow. And much like what we do here at Hydrite, is a lot of our job is helping you grow your business. But beyond that, I'm hoping that you guys will join us here shortly for our keynote speaker, Melanie Hellwig-White. She's the president of Hellwig Products. So that'll be starting up at 2:30. And look forward to having the recordings out there. So if you missed any of the presentation today, that it'll be available to you shortly.
Excellent.
Thanks, everybody. Take care and have a great weekend. Wash your hands, break
Yeah.
down the biofilm mechanically, and then sanitize.
Bingo.
Take care. Thank you.
All right, thank you.